So, good morning, everyone. How are you all doing? I get to see one face. Hi, good face. So, I just want to start with introducing myself and just kind of giving my background, and I'll talk about my profession a bit. I am Dana Powell Baker. I'm a professor at the University of Kansas Medical Center. And so, I'm here in the heart of Kansas City, where our medical center is located. And so, we have the School of Health Professions, in which I teach in the Department of Clinical Laboratory Sciences. We also have the School of Nursing, and we also have the School of Medicine. And so within my role, I've worked as a medical laboratory scientist for almost 18 years now. And so that's why I get the awesome opportunity to teach the next generation of medical laboratory science. And so with this profession, not too many people know about it, have heard of it, but we've definitely heard a lot more about it in the last year with COVID-19. So you've heard about COVID-19 testing, how we need more qualified people to perform the test. Where are these people? Who are these people that perform the testing? We are those people. And so not only do we perform COVID-19 testing, but we also do all kinds of other testing. So if you've ever had your blood work drawn and tested, if you've ever had a family member or know someone who's been diagnosed with a certain disease or condition, it could be diabetes or strep throat or the flu or unfortunately various forms of cancer. But we're part of that healthcare team picture as being the ones that actually perform that testing. And those results that are generated by the work that we do is then used by the doctor or by a healthcare provider to make that medical diagnosis for a patient. And so I was going to start with a short video just to help kind of illustrate what we do in the lab. And then we'll come back together and I'll go over a couple of slides just to kind of show you our career path and just go from there.
Pathologists and medical laboratory professionals are at the very heart of your healthcare. They save lives every day by diagnosing your medical conditions. These scientists make 70% of all diagnostic medical decisions in healthcare. Your primary care doctor, your oncologist, your surgeon, and your child's pediatrician all rely on pathologists and laboratory professionals to make the right diagnosis at the right time so you and your family can be treated quickly and effectively. Our job is to save lives through accurate and effective diagnoses. Your health tomorrow depends on pathologists and laboratory professionals who are making an impact today. To learn more about these life-saving professionals, visit ascp.org. Made possible through the generous support of the ASCP Foundation.
Okay, so that's just a short little glimpse of what we do. But I also want to share this website with you all. It's called whatsmynext.org. And so it's a really good website. It's actually, the video is produced by an organization called the American Society for Clinical Pathology, which I'm a member, and that's who I have my certification through as a medical laboratory scientist. But we also operate this website as a part of our Career Ambassadors program. So I'm a career ambassador. So that just simply means that we promote our profession, that we meet students just like yourselves, just to share what we do and what our profession is all about and the different career paths within it. And so this website was created just so that it provides more information. So what does it mean to be a lab professional? What are the different career opportunities within this field? And so if you go all the way to the bottom of this page, there's different roles that are represented. So such as a medical laboratory technician, I'll talk about a little bit more. That's a 2-year degree program. So because I teach at a 4-year university, doesn't mean that you necessarily have to take a 4-year path to get to be or work in the laboratory, but we'll talk about that in a little bit more detail. But also there's other roles such as a cytotechnologist. We have medical laboratory scientists such as myself, and she's actually a really good friend of mine. And then we have pathologist assistants. That's another role. Pathologist, that's for those who not only go through their 4-year degree, but also decide to go on to medical school. And that's a specific specialty. Once you do go to medical school, it's a pathologist, and then a hematology specialist. But you can view all these careers, view the career paths, how they got there. Also for my educators or educator in the group, there's a link here. So if you need additional resources, you can go there and request resources that also have all this information or content that you can provide to your students. So that is that. And then, all right, so what does a medical laboratory scientist do exactly? So we're the ones that analyze blood and body fluids using sophisticated laboratory instruments. Some may call them analyzers, or you may hear them referenced as machines, but we tend to call them instruments because of their sophisticated capabilities in identifying different enzyme levels and different disease states. We also perform identification of bacteria and viruses that can cause infection. We also cross-match blood for transfusion. So if people have ever had a blood transfusion, we're the ones that are able to say this blood product is safe and compatible for transfusion into this person. Also, we test enzyme levels that detect for cancer, heart attacks, diabetes, and other forms of diseases. So literally thousands upon thousands of different tests are out there that we can perform. Also, we break down into different areas of the clinical lab. And so we'll have chemistry, and that's where you see a lot of our automation. We use a lot of chemistry analyzers to perform all those various tests. We have hematology, where we actually get to look at the cells. So we're looking at healthy, or we're looking to hopefully find healthy cells. If they are abnormal, we can also identify that and describe why or how it's abnormal. And so that includes white blood cells. So that's a neutrophil. So that's going to be your most abundant white blood cell that you have. And that actually protects your body against bacterial infections, or helps to fight against bacterial infections. And then your red blood cells. And so you've probably heard of sickle cell anemia. And if you haven't, that's one type of anemia where you see how these red cells are perfectly kind of round, where literally the cell collapses in on itself, creating a crescent shape or a sickle shape. And so the main responsibility of your red blood cell is to carry oxygen throughout your body, so to the various organs and the tissues and what have you. And so if it collapses in on itself, it's not able to carry oxygen as well or as efficiently. And then if it's not carrying oxygen well, then it's definitely not going to get oxygen to those tissues. And then it's also going to have issues with moving through all the various vessels in our body. So hence why you'll hear about sickle cell crisis, or hear about people having breathing issues with sickle cell anemia, because you lose that oxygen carrying capacity with your red blood cells. But also we have the blood bank. So that's most of my background. I've worked in various blood banks throughout my career, but once again, that's where we identify safe blood products for blood transfusion for patients. Then we also have clinical microbiology, and in there we're identifying bacteria, viruses, even different fungi, depending on how you like to say it. And we also have DNA testing. So that's part of molecular testing. Molecular testing and genetic counseling kind of can go hand in hand. And so some people like to think of DNA testing more so like identifying different disease states. How do we inherit certain diseases or genetic disorders? And we could use DNA testing or molecular testing to help us with that. But that also kind of goes together with genetic counseling as well. So as far as this work goes, all these various areas, we can either become generalist. And so I'm a generalist, so I could work in any one of these areas because of my education and my certification. But you have some that choose to specialize. And so they'll become a specialist in hematology or a specialist in chemistry. So there are different options for that. And so as far as essential functions, it's very important to have good motor skills and good reasoning skills. Hand-eye coordination, hand dexterity is really important, because even though we may have instrumentation, we also do a lot of manual test procedures as well. So that's what really comes in handy there. Effective communication skills. We're not just working with each other. We're part of a healthcare team. And so we need to be able to effectively communicate with other members of the healthcare team, all the way from your physicians, all the way to your environmental safety or worker team. So really we work with everyone, really everyone and anyone when it comes to healthcare. environment. Also, visual acuity is very important because we may use microscopes a lot. So you might need to have both microscopic and microscopic analysis capabilities. You need to be able to work independently, but also as a team. Once again, you're part of a team. And time management is really important because if they need something stat, like right now, versus stuff that could be done a little bit later, you need to be able to prioritize your work. And for all of this, regardless of if you go into medical lab science or if you go into any healthcare profession, it's really important to have a good foundation in science and your math courses. I know it's not the easiest. I know my 13-year-old likes to say math is for me, but I'm like, we got to get through it, girlfriend, because it's critical, especially if she plans to become a nurse one day. And so, definitely make sure you have a strong or firm foundation in those two key areas. And so as for me, I do have my Bachelor of Science degree in medical technology. That's what it was at the time, but now it's medical laboratory science. At our school at KU, we actually have it as clinical laboratory science. It all means the same thing. Once our students complete their education with us, they then have to sit for the national certification exam to become a medical laboratory scientist. So just how you hear about board exams, like with nursing or with other healthcare professions, we have to do something similar as well. And so this is my favorite slide because I'll have some students say, you know what, I don't know if I want to do 4 years of college. I'm not sure if I'm ready for that, or it can even be a financial issue or family concerns. I know for me, just to share a little bit of background of myself, I didn't grow up in like the best neighborhood. I didn't grow up with what, you'll call like a silver spoon in your mouth kind of thing. I'm a first generation college student. So I was one of the first to go in my family. And so college was not a commonality for my family, let alone for people in my community. They didn't really consider college to be their path for after high school. But it's really the choice that you decide that you want to do. But just know that, there's no barrier or no boundary there for you. It's really a matter of, what is best for you and for your life situation at the time. But I like to tell students, if you want to get your foot in the door, start with being a phlebotomist. You can become a phlebotomist as early as the age of 18. Some states will allow you to do phlebotomy at the age of 17. Some hospitals will provide on-the-job training. Also, there are certification programs out there. I know here we have a community college. Is it Metropolitan Community College at Penn Valley? They actually have a phlebotomy certificate program. And so it's not like a year-long program. It's literally maybe like 16 weeks long. But still, it's an abbreviated schedule for training, and you're starting a career. And so whether you intend to go further, go into nursing, go into clinical lab science, go into respiratory therapy, whatever the case may be, it's a great foot in the door. You get to get around all these different healthcare professionals, see and somewhat kind of shadow what they're doing until you get a feel for what it is you truly want to do or truly what you want to be. And usually for education, the minimum requirement is a high school diploma or a GED. So if you decide to go on to college or further your education after that, you have this really awesome part-time job that you could be doing in the meantime as a phlebotomist. So it's just really a great opportunity to build your skill set there. Also from there, we have the specimen processing technician or a laboratory processing technician. Same thing, you could get on-the-job training there with that. High school diploma is a education requirement there, or GED, depending on the job listing. And there are certification programs for this, but for the most part, most people just receive on-the-job training. And so these people, so phlebotomists, they're the ones that collect the blood samples or collect the specimens for us to do the testing. But the specimen processing tech is the one that prepares the samples for us. So they'll make sure or verify that we have the correct sample for the right test. They'll centrifuge it or help separate out the samples and get them to the various departments that they need to go to so that we can perform the testing on those samples. And then at the end of this, we have medical lab technician. So this is a 2-year degree, as I mentioned before, an associate's program. This is an entry-level position into the laboratory as well. Certification is required for this. So at the end of that 2-year program, you're sitting for a board exam just to say that you are entry-level ready to work in the laboratory as a testing technologist, pretty much. So you're performing laboratory testing, very similar to a medical lab scientist. It just may be limited as far as how much of it or the scope of it that you do. But in many settings, a lot of us are doing the same work. We just have a different level of education and a different certification. So that's really more or less those different ladders or pathways, I would say, for that. And then the other thing I'll add to this too is for a lot of employers, if you get your foot in the door and they see like, wow, this person's amazing, hardworking, motivated, driven, I would really love to support them in going back to school to further their education. So you will have some employers that will do tuition reimbursement or will actually help pay for you to go to that next step in your education. So you come in as a phlebotomist and you're like, you know what, I want to be a medical lab technician. They may actually help cover those expenses for you because they see that as an investment into their own employees or their own team members. And so that way they're keeping you there, but also helping support you to move along or up that career ladder. So just kind of keep that in mind once you get your foot in the door with these type of professions. And we wear scrubs like everybody else. Of course, our personal protective equipment and the job outlook, whether you're looking at phlebotomist, processing tech, a medical lab technician or MLT, or such as a medical laboratory scientist like myself, job prospects are really great right now. And sadly, it is, of course, due to COVID. We need more people. We need more qualified personnel. We need more hands on deck. So we're always looking to grow our workforce and to strengthening it, rather. And so you don't have to worry about that. I always tell people I graduated on a Friday. I started my job that Monday, and I haven't been without a job ever since. And so I've been consistently employed for the last 18 years and counting. So job stability and security is definitely there if you so seek it. So is there any questions that I could answer at this point? And it could be about medical lab science, or if you have an interest in something else, especially if it's healthcare related, I would love to hear it.
I'll get it started. So I know you mentioned math is a really important skill. Our middle schoolers often are kind of considering like electives or, different things that aren't just math, science, social studies, or English. Are there any certain like pathways that you might find really beneficial with extracurricular classes?
Yeah. So I'll say anything dealing with health, of course. So I did healthcare occupations when I was in high school. And that really, I would say, motivated me to say, yeah, I definitely want to do something in healthcare. So that was a really great, fun opportunity to learn more about different healthcare professions. I think we actually received our first aid CPR training in that class. We did our first blood drive in that class. We learned how to properly hand wash in that class. And that skill set literally stuck with me from the age of 17 to whatever number I am now. But so it's amazing what you retain from that time period. And so anything healthcare occupations, anything, I know they have biomedical classes. I mean, anything in that realm, even if it's a child care development class, anything dealing with health, human growth, or human development. If there's opportunities to get your CPR certification, if there's opportunities to, I know some schools offer that CNA training or track, anything STEM related, any one of those will work. But I find most students like to go the healthcare occupations path. It doesn't feel as strenuous on top of your other courses, but it's a great fun class. And it's just a great way to explore different healthcare professions. I would also encourage, any form of volunteering. I know that's hard to do at this time, but just something to keep in mind. If you're able to volunteer at any point down the road, if it's not at a hospital, once again, it could be a childcare facility, a nursing home, and it could just be reading or helping to write letters or whatever the case may be. It doesn't necessarily have to be something healthcare specific, such as that task, but just being in that environment or just being in that type of setting speaks volumes to, your ability to care for people, to relate to people, and you're still overhearing everything that's going on. So just really being a sponge when you are in those environments, because just getting used to how we work and how we operate will really be beneficial to you as well.
Thank you. That was a great answer. Appreciate it.
Oh, no problem. And I just saw a question. How did you decide what you wanted to do? Funny enough, or interesting enough, so I grew up wanting to be a doctor. I always wanted to do that And it was really more so related to my mom. My mom's been, she's a 4-time cancer survivor. And so growing up, she had various diagnoses or illnesses when I was younger. And it was, painful for me to watch in that, you feel helpless as a child or as a teen because you want to help, but, you're really limited in how much you can help. And so I think out of that, I was like, I want to go into healthcare. I want to be able to do something that will help, my benefit my mom. And so that way, even if it's just me helping to explain a procedure or helping to explain, how this diagnosis came to be. And so when I was in high school, she was actually told that she would not survive. Probably by the time I would have graduated, we were expected to lose her by that point. But I'm happy to say she's still here. She's a fighter. And so I guess I get that fight from her. But that's what really motivated me to go into a healthcare career. And when I got into college, I was like, I was good in science. I was good in math. I knew what my strong suits were. And I came across this degree. And I was like, it looks like I can pretty much get a job when I graduate. That's really where my focus was at the time. I didn't think of it as a career at the moment. I was really thinking of, I need to get a job when I graduate because I need to help my family, especially knowing how much they were investing into me and knowing that I needed help, back. That was really what was my motivation at the time. But then it grew into a career and I've been able to grow and advance in it. And my family's doing great. So it all came together. And I saw another question. Is there an internship with my career? Yes. So our students, once they get to a certain point where they finish all of their courses, and this is the same with a medical lab technician position or even with phlebotomy. So once you do your core coursework, reading and taking your test and what have you, and you pass that point, then you're put into a clinical internship or a practicum is another term that we use. And so that's where you get all of your practice hours and build upon that to the point where we say, yes, this person is competent enough or able enough to actually do this as an entry-level job. And so that is a very crucial part that usually comes on the tail end of that experience. Some schools, depends on the program, they like to kind of weave it in throughout. So you're learning some and then you're applying it and then coming back to learn some more and then applying it. So either approach is fine, but either way, yes, we do have that internship component. Leading up to this job, what was your favorite part of your education and what did you enjoy learning about the most? I think my favorite part was the camaraderie. It wasn't an easy program, I'll be honest with that, but because of the friendships I was able to build and some of them I'm still close with, even nearly 20 years later from the point that we started. And so it's just really awesome to know that, we all came in this together. We all survived it together. And a lot of us are still connected even to this day. And so that to me was really cool. But it was also really neat to see how you go from the classroom into your clinical internship and you have your aha moments. So whatever wasn't clicking in class, you go into that internship and you go, oh, that's what they were saying all along. And oh, I can see how I contribute to helping save lives. Like, this is really neat. Like, I'm really going into something that's going to help other people. And so really being able to see that and know that, I didn't have to be a doctor. I didn't have to become a nurse to be able to see that connection. That was really neat. And I come from a nursing family, so I didn't mention that. So my grandmother was a LPN, so she was a labor and delivery nurse. And then my aunt retired as a nurse as well, so she was an RN. But so I went a different path when it came to healthcare, but it was nice to see that I could still contribute in that way. And what did I enjoy learning about the most? I said that same answer, just learning about this profession and learning about how this profession contributes. About 70% of the work that we do, let me backtrack, 70% of the medical diagnosis made is based off of the work that we do. And so, for a doctor to be able to treat a patient, to monitor a patient, to, do the diagnosis piece, a good portion of that relies on the lab results that we provide. So either it's going to confirm what they're thinking, like, yes, you do have this, or it's going to help change that care plan for the patient as in, oh no, it's not that, it's actually this. This is what we need to start doing to help this person get better. Does it help you to speak different languages in your career? Absolutely. If so, which do you use the most often? So, of course, I use English most often. That's my first language, but yo hablo español también. So it helps to know another language. With Spanish, definitely increasing in popularity here in the US. I would say Spanish is very helpful, but also I've had colleagues that went back to school for various, Mandarin, Cantonese. I have some that learned how to speak Arabic or Hebrew, especially if they went through the military route, depending on where they were stationed. And so being able to bring that back has been really helpful for them, especially when we get into very diverse, I would say, urban populations, such as, Kansas City, Los Angeles, Atlanta. So I'm from Atlanta. And so you never know, what patient's going to show up and what language they speak. And so, Spanish will be the most common that you'll see a lot of healthcare professionals go to as their second language. But we also need people who speak a little bit of everything. You just never know. I actually had a patient that was from Nigeria, and we didn't understand the language that was being used. So I went to my friend, knowing that she was from Nigeria, and I'm like, "Hey, you speak this language too, right?" She's like, "No, I'm actually from a different tribe. I speak Yoruba." And this other person spoke Igbo. And I was like, "Well, great. That doesn't help." So you can't make that assumption either that, one Spanish is the same as someone else's Spanish, that, if people are from the same country, that they speak the exact same language too. So variety in language helps. In any language, we'll take any language. But language is going to be especially important for anyone who's patient facing. So if you're doing phlebotomy, if you decide you want to become a nurse, any direct patient contact, any language that you have under your belt, you definitely use that as your asset.
You said you're from Atlanta, but now you're in Kansas. How did your career education take you on the journey?
So really, it took me all over the place. So I started in Atlanta. I actually went to Georgia Southern University, which is just outside of Savannah, Georgia. And from there, I did my clinical rotations in Charleston, South Carolina. So I went to the Medical University of South Carolina. I was part of the first group to go there. They really wanted to bring students in, and I wanted to get out of Georgia at the moment. So that was my opportunity to fly. And so I went there for a few years, and then I ended up back in Atlanta for a couple of years, and actually ended up getting a job offer out in Phoenix. So I ended up going to Phoenix for a couple of years. But even with that job offer, which is really cool. So if you do really amazing in your work, people will pay for you to move. So know that. So when I went to Phoenix, they actually paid for my move and helped me secure a deposit on a new place. And so that was really cool as a sign-on bonus. And then I was in Phoenix for a couple of years before Kansas City. And so it's really taken me all over, even the professional organizations that I'm a part of. So the different conferences that I'll attend have literally been all over. I've been to Boston, I've been to Minnesota, San Francisco, been to Texas a few times. So yeah, I didn't expect that going into the line of work that I went into, but it really has taken me all over the place. So even, in addition to the job that you have, look at the professional organizations, such as the one that you may have your certification through, and see what kind of opportunities are there, especially volunteer opportunities. So as I mentioned earlier, I'm a career ambassador for the American Society for Clinical Pathology. So this background that I have is for our upcoming National Lab Week celebration that we're going to have in April. So this year's theme is Avengers. But me volunteering for this organization and serving as a chair for one of the committees, I'm able to fly to Boston at the end of the year because of my role, just volunteering and doing that. So, volunteerism there's benefits to, just wanting to contribute your time.
Are there organizations that you joined as a student that helped you? Something like National Honor Society or anything that was related to the health professions?
Yeah, so I actually was part of the National Honor Society. I also joined clubs at school. So anything health club related, but also did debate. I did Beta Club, but even going into college, I looked for specific clubs that were really related to the work I was wanting to do. But I also picked some that were just very different and kind of opposite. So that way I was kind of balancing both sides of the brain. So like in high school, I may have done something like Y Club or Beta Club, but I also did dance club too, because variety is really important. And, you don't want to find yourself getting bored or complacent in one area. You need to kind of balance yourself out as best as you can, because those other, I won't say random, but other clubs or participation things that you do that may not relate to your career actually helps you connect with people. And so I could say, oh, I did dance too, it's like, cool, and that can actually help relax a patient. And before you go, okay, now I need to, draw blood from you. But, I'm glad we had this conversation and that we bonded for a moment, So, anything extracurricular, even if it's extracurricular sports, that can really be the tie that binds, so to speak, where you are able to have that connection with people through that. And then now I need to perform my job, but hopefully you're more comfortable with me now so that we can get through this together.
What is maybe the most interesting connection you've ever made with a patient before?
I think the most interesting one, it wasn't actually like in a clinical capacity, but I was actually on my lunch break at the hospital and I went to the cafeteria to grab my food as I normally would. And I was working at a children's hospital at the time. And so there was a mother there sitting there with her son, and he was wheelchair bound. I think he also probably had some form of cerebral palsy, or that's how it appeared anyway. But she was struggling to try to get him situated and pick up like her lunch trays and all of that. And so me seeing that, I stopped, I grabbed the trays and I said, don't worry about it. And I cleared the table for her and put those things away. Was it my job to do that? No. But, you just see someone who needs help, I help. I did that. As soon as I turned around, she leaped on me with a huge hug. I mean, like a hug she would not let me go. And I was like, okay, and she was like, no, thank you. You just really don't know, just in that small of a gesture, how much that meant to me. Just to know that, someone was watching and cared enough, to step in and help. And so it's not always clinically that you can help people. It can also just be in your kind gestures, holding the elevator door open, holding a door open, or help, seeing someone's in need of, help with just food trays. You can help people in so many different ways. I think beyond what we can ever think or imagine.
That's fantastic. I want to thank you so much for the time that you spent with us today and all the information you shared and sharing some of your anecdotes and personal stories.
No problem. I hope it helped a little bit at least.
Absolutely. And students, thank you guys so much for participating as well.
Thank you all.